We are now hearing from the Centers for Medicare and Medicaid Services just days after a local congressman asked the agency to investigate months-long Medicaid delays in Texas.
That program and the wait potentially impacts millions of low-income and vulnerable people here in the state. And KXAN's investigator Matt Grant is joining us now to talk more about what the federal agency has to say about all this.
Well, CMS officials say they'll respond directly to Congressman Lloyd Doggett, who sent the agency this letter on Monday calling for the Texas Health and Human Services Commission to be put on, quote, a corrective action plan following lengthy delays processing applications. This week, HHSC acknowledged it's taking up to 120 days for combined Medicaid and food benefit applications to start being processed. The health policy research nonprofit KFF found 1.4 million Texans were disenrolled from Medicaid, the highest in the country since pandemic-era coverage protections ended in April. CMS says in August it required Texas to reinstate Medicaid coverage for nearly 100,000 people who were improperly disenrolled due to systems errors or systems issues, which it required the state to fix. CMS says Texas has the lowest number of auto renewals in the country. That's when a state checks available data to verify eligibility before requesting someone fill out a renewal form. So basically to make it easier for people to not lose their coverage. A CMS spokesperson says it's continuing to closely monitor renewals in Texas for Medicaid and for the Children's Health Insurance Program, or CHIP, to ensure that Texas is staying in compliance with federal standards. In a statement, CMS officials tell us any person being improperly disenrolled from health care coverage is unacceptable, adding some states need to do more to protect coverage, and saying we have put all states on notice and will not be afraid to take enforcement action. Matt Grant, KXAN Investigates. Back to you.
All right, Matt, thank you very much. And HHSC tells us it continues to work with federal partners as it redetermines Medicaid eligibility, adding that it identified the individuals who were improperly denied coverage. Officials say they worked to quickly reinstate coverage and have not been asked to pause Medicaid disenrollments.
Now, this all comes as Congressman Doggett plans to meet with the U.S. Department of Agriculture to discuss long delays with federal food benefits here in Texas. This week, we told you HHSC is incentivizing staff with prizes to work 15 or more hours of overtime, calling it the 6 days of merry service. Now, the goal here is to drop the time it takes for an application to be reviewed to between 50 and 70 days. Even if that goal is met, the agency would still be out of compliance with federal rules.
They have set for themselves a best case aspirational goal to remain out of compliance with federal law in the future, and that's just not acceptable.
The group of anonymous HHSC employees who blew the whistle on long wait times told us, quote, instead of a competition, we need resources to do our jobs.